How's it going, guys? This is Dr. Sean Harris here with Ignite, and I have with me
Dr. Casey Hankins.
And we just wanted to take a minute to talk about what Ignite is and why we think our educational program is so important. So I've been out from PT school for 10 years now, and when I started the physical therapy program, I was dead set on focusing on orthopedics and sports and really didn't have any idea that there was anything else for physical therapy. But as anyone who's been to physical therapy school knows, you have to learn neuro, rehabilitation, wound care, geriatrics. There's all pediatrics. There's all different types of physical therapy specialties. And the reality is that when we actually get into clinical practice, most of us have a kind of a specialized area that we focus on our patient population. And unfortunately, our program is to develop generalists because you have to pass the boards, and the boards are reflective of general practice, all of those modalities under one. And so what I found early on is that there is a huge vacancy in terms of specializing in orthopedics and sports medicine, and you're just kind of thrown out there into the clinic. And we all know you've got a super busy caseload, you've got paperwork and documentation that you have to keep up with, and then you're also expected to provide high quality care. And I always joke that those are the three expectations. You want to be productive, you want to provide excellent care, and you want to finish all your documentation timely. And the joke is you can only pick two of those three things to do at any given time. So our goal with Ignite is to help fill that vacancy over the first couple of years of clinical practice, where you graduate, you have your degree, you're a doctor of physical therapy, and yet you feel like maybe post-operative management, advanced differential diagnosis, other skill sets are missing. And when you're in a fast-paced, busy clinic, you may or may not have the time to focus on learning and developing those skill sets. And I firmly believe that the progress that you make within the first 3 to 5 years really sets the trajectory for your success long-term. And our goal with Ignite is to create content that helps to bridge that gap and set that differential framework and advanced orthopedic framework for everyone to be successful in their career without having to necessarily do a residency program or go back into any other high-level training. And so we've set up our curriculum to try to target those specific areas and grow that framework. And the benefit you guys have is that we do all the work for you. All you have to do is, pay and show up and keep an open mind, and we'll help bridge that gap all the way up in a variety of different orthopedics and sports settings.
Yeah. We know that when you are graduating from PT school, you've gone through college, you've gone through PT school. You are not the relaxed, I'm just going to take things how they go. You are the go-getters that I came into this profession so that I can help people and make an impact. But a lot of times when you go into the clinic and you are reality hits in and you realize that, wow, my time is limited. I don't know how to treat these patients in front of me. I feel like I'm the one responsible, but I just don't know what to do. And maybe the mentorship that you thought you would have was not there. But then when you're looking around for help and answers, there are so many voices out there on what to think, but not always how to think. So being able to maximize the time that you have and still be able to be a productive clinician and still be able to be a sibling, a daughter, son, father, husband, wife, etc., fill in whatever that is for you. It is hard to be able to find that source of education and be able to quickly integrate it into your practice and apply it to new and unique scenarios. So our goal with this is to help you be able to be the best clinician that you can be by helping you to understand why we know in our research, in our evidence-based research, certain things are the way they are and how to apply it as new situations unfold in front of you.